HAVRIX 1440 hepatitis A vaccine.
HAVRIX is used to prevent hepatitis A caused by hepatitis A virus. Hepatitis A virus only causes acute infection and is not associated with chronic liver disease. It is important to note that HAVRIX prevents hepatitis A. It does not treat an active infection. HAVRIX is a monovalent formalin inactivated whole virus vaccine. Monovalent means it is designed to immunize against a single antigen, strain, or microorganism. Inactivated means the virus has been chemically killed and cannot replicate. Whole virus means the entire virus particle is used, so not just a protein or a fragment. And formalin inactivated means it is inactivated using formaldehyde. How HAVRIX came to be. HAVRIX vaccine is manufactured by propagating the hepatitis A virus in MRC5 human diploid cells. These cells are lysed to form a suspension and purified, and then inactivated using formaldehyde and absorbed into aluminum hydroxide. In the 1970s, scientists successfully grew hepatitis A virus in a cell culture, which led to the development of inactivated whole virus vaccines. HAVRIX was developed by GlaxoSmithKline in the late 1980s and approved in Canada in 1994. The production and approval of HAVRIX led to a dramatic decrease in hepatitis A infections and outbreaks globally. Age administration in series. HAVRIX is approved for use in persons 6 to 12 months of age and older and is given in a 2-dose series 6 months apart. For optimal protection against hepatitis A, HAVRIX should be given 14 days prior to an anticipated exposure. Dosage and administration. HAVRIX is given in a sterile suspension IM injection in a pre-filled syringe. HAVRIX 1440 is 1440 ELISA units per 1 milliliter, and HAVRIX 720 Junior is 720 ELISA units per 0.5 milliliters. In adults and children, HAVRIX is administered IM in the deltoid region. In young children, the preferred injection site is IM in the anterolateral thigh. A fine white deposit with a clear colorless layer may be observed. The vaccine must be resuspended prior to administration. Once a clear white hazy suspension is observed, the vaccine is ready for use.
Who gets the vaccine? People with increased risk of infection, including men with chronic liver disease, men who have intercourse with other men, individuals who engage in injectable and non-injectable substances, travelers to HA endemic countries, workers involved in research of HA, and people in close proximity to people infected with HA, including many more. Who doesn't get the vaccine? Individuals presenting with severe signs of infection or acute illness, such as high fever, should not receive the vaccine. Mild illness, such as colds, are okay. People with severe allergic reactions, anaphylaxis to previous Hep A vaccines, and or any components of the vaccine, including aluminum. Also, age is a consideration. The HAVRIX 1440 should only be for individuals 19 and older, and the Junior 720 should be used for 6 months to 18 years of age. The approximate success rate of pre-exposure to the HA immunization is 90 to 97% effective. Primary immunization provides protection for at least 1 year, and the booster dose is required for long-term protection. Some common or mild transient reactions usually include soreness and redness at the injection site. And for the IG reactions, or the booster, redness, arrhythmia, stiffness of local muscles, mild fever, and malaise can all be expected for common side effects. Some more rare or less frequent side effects include headache, irritability, fever, fatigue, GI symptoms, and injection site reactions. The booster includes flushing, headache, nausea, urticaria, and anaphylaxis as some more rare side effects. An interesting fact about the HAVRIX 1440 vaccine is that it must be stored in a refrigerator and should never be frozen, as the aluminum within the vaccine is irreversibly damaged by freezing it. These are all of our resources, and thank you for listening.